High blood pressure affects nearly half, listen to this, nearly half of the adult population in the U.S., yet many people who have the condition don't know it. Touro internal medicine physician Dr. Schuyler Williams joins us to talk about hypertension and the importance of getting screened. Dr. Williams, good morning to you. What exactly is high blood pressure? What happens to your body when your blood pressure is high?
Well, hypertension, which is also commonly referred to as high blood pressure, is a condition in which there is an increase in pressure against the arteries in the body. Arteries are blood vessels which carry blood from the heart to other areas over the body. When we see an increase in the pressure in those arteries over time, it can cause heart problems and other health consequences.
So when you see your doctor and, your blood pressure is fine as you're in your 20s, 30s, 40s, whatever, when you get that first little, hey, it's coming up a little bit, that can be a real warning to back off on your behavior and take it seriously and prevent other problems down the road?
For sure. So many people who have high blood pressure have no symptoms at all. And additionally, what we've learned over time is that when you're at the doctor's office, we're getting a blood pressure measurement at one point in time. So if you find that your blood pressure is elevated, please check your blood pressure while at home. That gives us more data points when you see your doctor. And then some big lifestyle changes to consider include making sure you're maintaining a healthy weight, eating a balanced diet and limiting the amount of salt you consume, and avoiding tobacco and alcohol use.
Is there a standard, it's high blood pressure for everybody, or can some people vary in what might be a problem for someone is not for someone else?
Definitely. There are different stages of high blood pressure. In general, anyone who has a blood pressure reading of greater than 120/80 should talk with their doctor, because you're going to fall into one of three categories. Either pre-hypertension, which means that you're at risk for developing hypertension. You either have stage 1 hypertension or stage 2 hypertension. I encourage anyone who's got readings over 120/80 to talk with their doctor so that your doctor can further assess which of those categories you might fall into and what would be next steps in managing your blood pressure.
Forgive me, we talked about some of the risk. If obviously people think about heart attack or stroke or that sort of thing, but there's a whole host of other problems that high blood pressure can contribute to?
Yes. High blood pressure untreated over time has been linked to strokes, kidney disease, including kidney failure, brain aneurysms, as well as heart disease. So that's why it's so important to get screened. Again, we call high blood pressure a silent killer in clinics.
All right. Well, a good message, I think, on this day from Dr. Schuyler Williams from Touro. We appreciate that reminder.
Thank you so much for having me.